Precision medicine, again, these are two incredible physicians at Sloan Kettering who helped invent a particular test called IMPACT, which basically tells each patient what their particular cancer looks like from a DNA standpoint. Now, we're talking about the mutations or the differences of the vulnerabilities of the cancer, not of the patient. So these aren't mutations that you were born with. These are mutations that your particular cancer has that are allowing it to grow and live. And next slide. So we've learned a way to manipulate this by taking your cancer, taking your blood, mapping the genome of you as a person, what you were born with, and your cancer, and comparing the two. And the mutations in the DNA of your cancer that you don't have in you are the things that could potentially be targeted as weaknesses. Next slide. And we have drugs to match those targets. This is just showing the process. It's all amazing, unbelievable technology that has literally developed in the last 5 years or 4 years. And it's now a commercially available test. Sloan Kettering has one test, or something called, there are a bunch of tests that are available. And if you have cancer, that's another question you should be asking. If I have cancer, what about clinical trials? What about profiling my tumor, doctor? Is there a role for finding out what weaknesses my individual tumor has? Because for many cancers, this is standard of care. For endometrial cancer, it is standard of care. Every woman diagnosed with endometrial cancer in the United States of America, particularly women of African descent, it is going to be paid for and it is approved. Why? Because, next slide. Next slide. I mentioned these are the basket studies, or is that the last slide? Okay. Because there is now an immunotherapy drug approved specifically for women with endometrial cancer who have this particular vulnerability in their cancer, and you have to test the cancer to find out. This is just an example of one of the incredible targeted medicines that works against these specific weaknesses. This is a patient with a type of breast cancer. On the left, you can see an X-ray image and all the black spots are bad. On the right, you can see the X-ray image after this patient was treated with this very high-tech specific targeted therapy. This is amazing result. This is a miracle, really. And we're seeing these miracles. Now, it's not for everybody, right? It's maybe only 10% of cancers are going to have targets for which we have a drug, but new targets are being, and new drugs are being developed every day. How? By clinical trials. So this is another reason it's so important. This is another one, a little harder to see, but this is ovarian cancer. So here you can see this ovarian cancer in red. It's sitting on this woman's spine. And this is a particular type of ovarian cancer that does not respond to chemotherapy at all. Then you see 1 year later, that mass is completely gone. And 7 years later, the patient is still on the drug, still no sign of this, right? And the drug doesn't have a lot of side effects. It's taken by mouth. Okay, next slide. So we have a program at Sloan Kettering where we are partnering with community oncologists who care specifically for poor patients, underserved patients, immigrant patients who have no insurance, who have no access. And we are performing tumor genomic profiling on every single patient, and we are matching these patients to clinical trials, whether they're at Sloan Kettering or somewhere else, if they have a target. And it's called the Impacted Program. And it's basically the purpose is to try to end disparities through tumor genomic profiling, participating in clinical trials. And this is very exciting. And one thing I know from personal experience is that the mistrust thing is not a factor, because the rate of patients signing up at Kings County and Queens Cancer Center is greater than the rate at Sloan Kettering, right? People immediately, I mean, we could not believe how many people are happy to sign up for this. So, next slide. Okay, so in summary, participating in a clinical trial is absolutely, in my opinion, the best way for people of African descent, I'm old-fashioned, I still say black people, sorry, affected by cancer to level the playing field. If your loved one is affected by cancer, ask about clinical trials, ask about profiling their tumor genetically.